Hi, I am Dr. Lokesh Handa. I am a senior consultant plastic surgeon practicing in New Delhi, India. I have been practicing in this field of cosmetic surgery for the last around 13 to 14 years and with a rich experience in the field of cosmetic surgery. Now let's talk about certain changes in the face that happen because of aging and how we can take care of them. So the major changes in the face because of aging are basically in the lids around the eyes, the upper lid, the lower lid. In the upper lid, usually there is skin excess and the skin hoods on the eye, and then in the lower lid, usually either hollowing happens or there are certain eye bags which develop in the lower lid. And in the face, then some hollowing can happen, loss of volume can happen, or the skin can sag. And in the neck, along with the sagging of the skin, then there can be bands which can form on the neck, and these are all the signs of aging. Now how can we correct? There are two ways that we can correct. One is the surgical and second is the non-surgical. First, let's talk about the surgical. Surgical techniques are usually the facelift and neck lift techniques for the face and the neck, and then there are the eyelid lifts, the upper and the lower, which is called blepharoplasties. With the blepharoplasties, we remove the excess skin on the upper lid. Also, we remove some part of skin in the lower lid and realign the muscles. And also, we put some fat and remove the eye bags under the eyes. In the facelift, again we stretch the skin. There is an inner layer of SMAS which is called musculoponeurotic system, which we stretch and then we tighten the face. Along with that, we put some fat where there is volume loss, and thus you get a very rejuvenated appearance on the face. And in the neck, similarly, the excess skin is removed and the neck is tightened, and the bands which are formed, they are also removed or tightened. The muscle which is causing these bands, that is tightened in the central part, and the excess skin from the sides is removed. Normally a facelift, of course it is since done surgically, so people think that it will leave a scar, but this scar is so well hidden, so it is usually put around the ear. So this is hidden inside the ear and also behind the ear and goes into the hairline. So this scar is barely visible to any person who is seeing your face. Now these are the surgical things. Coming to the non-surgical part, non-surgical involves usually two things. One is the Botox and second is the filler. Now what is the difference in the Botox and filler and where it is used? In aging face, there are two kinds of wrinkles that are formed. One is the static ones and the second is the dynamic. Dynamic is when we are animating. In the forehead, if you are raising your eyebrows, so when you raise the eyebrows, then the wrinkles that form, these are called dynamic wrinkles. That is when the muscle is acting and then the wrinkles are forming, these are called the dynamic wrinkles. So for the dynamic wrinkles, we use Botox, where that particular part of the muscle is paralyzed and the wrinkles are reduced. Similarly, along with the forehead, then around the eyes, this is called the crow's feet area, where if you close your eyes, then the wrinkles can form. So we can put Botox around the eyes. And in the nose also, when you scrunch, then the wrinkles can form on the nose. So these upper part of the face, usually Botox is required as an anti-aging treatment to reduce the wrinkles. And for the lower part, also the upper part also, but specifically for the lower part of the face, the fillers are required. Now fillers is usually done for the static wrinkles where there is no muscle action happening and where there is hollowing out. Hollowing out usually happens under the eyes. It can happen in the cheeks and the areas particularly which is called the temporal areas or the temples, which is around the junction of the forehead and the cheeks. So in these areas, fillers they play the role. So filler is basically made up of hyaluronic acid, and this filler is injected in the hollowed out areas. Also it is injected in the static wrinkles, particularly between the nose and the lips, which are called nasolabial areas. Then in the chin, under the lips. Also, if the lips are thin, then the filler can be put in the lips to give volume to the lips. So these are the areas where fillers are required, and these give you a very rejuvenated appearance, a very youthful appearance. So it's a combination of Botox and fillers which can give your entire face a very youthful look. And for further queries, you can contact CureIndia.com.
If you are interested in treatment in India, please subscribe to our channel and press the bell icon to never miss a new video from us.